Dementia is a broad term that refers to a group of symptoms affecting cognitive function and behavior, while Alzheimer's disease is a specific type of dementia. Dementia refers to a decline in mental abilities that are severe enough to interfere with daily life. This can include problems with memory, communication, attention, reasoning, and visual perception. Dementia is caused by damage to the brain cells and their connections, which can occur due to various factors. Some of the common causes of dementia include Alzheimer's disease. This is the most common cause of dementia, accounting for 60 to 80% of all cases. It is caused by the accumulation of beta-amyloid plaques and tau tangles in the brain, which lead to the death of brain cells. Vascular dementia. This type of dementia is caused by damage to the blood vessels in the brain, leading to reduced blood flow and oxygen to the brain cells. Lewy body dementia. This is caused by the accumulation of abnormal proteins in the brain called Lewy bodies, which interfere with the normal functioning of brain cells. Frontotemporal dementia. This type of dementia is caused by damage to the frontal and temporal lobes of the brain, which are responsible for language, behavior, and personality. Huntington's disease. This is a genetic disorder that causes the death of brain cells, leading to dementia. Creutzfeldt-Jakob disease. This is a rare, degenerative, and fatal brain disorder caused by an abnormal protein called a prion. Parkinson's disease. This neurodegenerative disorder is caused by the loss of dopamine-producing cells in the brain, leading to motor and cognitive symptoms, including dementia. Traumatic brain injury. A severe head injury or repeated blows to the head can cause damage to the brain cells, leading to cognitive impairment and dementia. HIV-associated dementia. This is a type of dementia caused by the human immunodeficiency virus, HIV, that attacks the brain cells. Nutritional deficiencies. Deficiencies in certain nutrients, such as vitamin B12 or folate, can cause cognitive impairment and dementia. It's important to note that some of these causes are preventable or treatable, while others are not. If you or someone you know is experiencing symptoms of dementia, it's important to seek medical attention as soon as possible for an accurate diagnosis and appropriate treatment. The following are the top 10 signs and symptoms of Alzheimer's disease. Memory loss. This is the most common and noticeable symptom of Alzheimer's disease. People with the disease may forget recent events or conversations, as well as the names of people and objects. Difficulty with familiar tasks. People with Alzheimer's disease may have difficulty performing tasks that were once familiar, such as cooking, driving, or using a phone. Changes in mood and behavior. Individuals with Alzheimer's disease may exhibit changes in mood, such as depression, anxiety, or agitation. They may also become withdrawn or exhibit changes in personality. Misplacing objects. People with Alzheimer's disease may put things in unusual places and then be unable to find them later. Confusion with time and place. People with Alzheimer's disease may become disoriented and confused about where they are or what time it is. Difficulty with language. Individuals with Alzheimer's disease may have trouble finding the right words to use, or may struggle to follow a conversation. Poor judgment. People with Alzheimer's disease may make poor decisions or show a lack of judgment, such as giving away large sums of money to strangers. Problems with abstract thinking. Individuals with Alzheimer's disease may have difficulty with abstract concepts, such as numbers or complex ideas. Changes in visual perception. People with Alzheimer's disease may have difficulty with visual perception, such as judging distance or identifying colors. Social withdrawal. Individuals with Alzheimer's disease may become withdrawn and avoid social situations that were once enjoyable. It's important to note that these symptoms may not necessarily indicate Alzheimer's disease, and a proper diagnosis requires a thorough evaluation by a healthcare professional. If you or someone you know is experiencing any of these symptoms, it's important to seek medical attention as soon as possible.